Meeting of the Health and Human Services Board together tonight in the Government Center, room 1400. Roll call, please.
Mike Barkalow.
Present.
Kathleen Findley is excused. Kathy Leaf.
Present.
Lisa Lind.
Present.
Deb Lindeman.
Present.
Wayne Rowan.
Present.
Julie Smith.
Present.
Greg Telejohn.
Present. Thank you. Minutes were in the packet. Is there any additions, corrections, or improvements? If not, they'll stand approved as presented. Public comment. Any public comment tonight? Public comment and public comment. No. Next is business. Introduction and welcome of Supervisor Wayne Rowan. Welcome.
Thank you.
You know everybody?
I think I've met or seen most of the folks, so.
Okay, good. You got anything, good words to say about yourself?
Well, there's a leading question for you.
Yeah.
I guess I would just say I'm very happy to be here, very happy to be part of the board. I spent most of my life in corporate America, but since retirement have been doing more public good nonprofit board kinds of things, and this is my first foray into government. So very much looking forward to try to bring my experiences from corporate America and other parts of my life to bear and make things better for the citizens of St. Croix County. And I should do a shout out to Dave Osnes, my predecessor, I guess, in a way. You know, I think Dave's many years of service and his effective service on this board and a lot of different places, you know, enough can't be said about sort of have big shoes to fill, and I'm aware of it. So thank you.
Well, welcome. Thank you. Next is a financial report for October 2025.
Okay, so we have the financials in your packet are from 2025, and I'm just going to do a real brief overview on how these are structured. We do have 3 different sections within this. The first one is Health and Human Services. The first few pages of this are a summary of all of the departments, and then we go on into like each individual department within Health and Human Service. The next section would be the healthcare campus, and then there are 3 departments, and the final section is Veterans Services. So as we look at this, we're looking at our remaining balance. So we have our budgeted amount for 2025, our year-to-date through October, and then our percent remaining. On our revenues, we're seeing a lot of greens, which is good. That means we've collected more than what we had initially budgeted. A lot of that is from grants that maybe came in after we had set the budget. And then what you're going to see in contrast to that is these expenses over here where we're over what we had budgeted, but a lot of those go hand in hand with those additional grants. When we get down here to behavioral health, one of the things you'll notice is our line item for purchase services. That is $279,000 over what we had budgeted. This is a trend we've talked about all year long that we've been monitoring. We've made some changes within behavioral health and addressed that in the budget for next year. So when you approved that budget, there was additional money allocated to that. Plus, again, we had made some changes in how we're doing business for expenses that we can control within that area. Children's services, again, their purchase services, these are the line items that are kind of beyond our control. But when you compare October of this year to October of last year, we're $600,000, less than we were at that time. We did have some placements that were high cost placements that ended, so that's helped to bring that number down. One of the other changes next year is, again, we had 2 positions approved in birth to 3 that are currently contracted services. So within our budget, we had budgeted less money for this next year. So that was really all I had to point out on Health and Human Services. Any questions on that section? Okay. With our healthcare campus, again, we're doing very well here. The healthcare campus as a whole is showing a positive 644,000. We do have our interim Medicaid rates that were effective July. These are below what they were last year. We're anticipating our final rates coming in sometime before the end of the year, and that they'll be what they were last year or maybe slightly higher. But with this 644,000, depreciation has not been booked yet for most of the line items. So after that comes through, they'll probably be about even up. So we're hoping that Medicaid rate, when it comes through, will help to keep them positive as they finish out the year.
Yeah, and depreciation is a non-cash flow item, so it's a book entry. So no money is exchanging hands when they book the depreciation. So while that might erase the book income that we have, there's still a real cash flow positive there.
Just double checking if I had anything else. Nope, so that was all that I just wanted to point out. Again, are there any questions on the healthcare campus? Okay, thank you.
Next is HHS Director's Report. Mr. Bob.
Thank you, Mr. Chair. Welcome, Supervisor Rowan. Good to see you again. You can see the Director's Report in the packet. What I tried to point out here in 3 different sections was some of the higher level efforts that are going on both at the state and local level to address some of those costs that Faye just referenced in the monthly financials. Those deep end costs or crisis-related costs, children in out-of-home placement, things like that. We don't have a lot of control over the costs themselves at this point, but some of the legislative efforts recently have been addressing or trying to address what to do about that, because all counties really are experiencing the same kind of stress on their budgets. So at the very top there is a couple of things just to remind you or make you aware of. Rogers Behavioral Health received a one-time $10 million grant in this last legislative session that will allow them to build a campus in Eau Claire related to really, I think, the whole full continuum of behavioral health services from outpatient to inpatient kinds of facilities. They aren't slated to have that, or they're not expecting to have that built until 27. But having a more local resource for, to help replace the Health Sisters hospital system, closing, 2 years ago, I think. This will help give us a regional presence here for a place to refer patients closer than Winnebago if the service is appropriate. And the other thing was a $10 million allocation by the legislature to fund this startup of crisis care facilities with an emphasis on the western region of the state. And these were also intended to be a more regional option for us to refer people to who have mental health and or addiction crisis. And these were originally called crisis urgent care and observation facilities, but the acronym for that was CUCOF, and we all thought that wasn't a very good acronym for a behavioral health facility. So the state in their wisdom changed it to crisis care facilities. There's going to be an RFP coming out soon from DHS. I don't know what soon means, but I expect it early next year. That would allow any interested entities to apply for that money for the startup of one of these crisis facilities. The idea then is to negotiate a rate with Medicaid through CMS, Centers for Medicare and Medicaid. And hopefully that rate, whenever that's established, will be enough incentive enough to incentivize providers to want to establish one of these facilities, so they have some reasonable kind of assurance that there'll be a sustainable funding source behind it. So that RFP hasn't come out yet, but when it does, and when that Medicaid rate's established, I think we'll see some interest in developing crisis care facilities. These would be a more acute care setting for people with, like I said, both mental health and addiction kinds of needs. The next section, section 2 there, it should really say legislative and policy recommendations that could impact HHS. These aren't signed into law yet. The first item there is fairly well established. The SNAP and food share changes. Rhonda's going to talk more about that, so I won't go into it right now. But the next one, the Medicaid for Justice Involved Individuals, is an effort, Senate Bill 598 and Assembly Bill 604, designed to help establish Medicaid benefits for people who are incarcerated, at least for the last 90 days of their incarceration. Currently, Medicaid ends when somebody is incarcerated, and that puts a lot of strain on jails for people. They lose their health care when they go into jail. So if any sort of medical issue arises, it becomes the responsibility of the jail to cover those costs. So if this bill has some momentum, so I'm hoping that we see progress there. The other thing it would do is provide Medicaid reimbursement for medications like it could be Vivitrol or Suboxone or some medication related to addiction that would help people as they leave jail rather than waiting until they get out to get that medication. The third bullet point there is the IMD waiver. It's a federal waiver that would allow Medicaid spending in institutions for mental disease. That includes Winnebago. And this was a law created back in the 60s, late 60s, as a part of Medicaid that prevents Medicaid from being used in institutions with more than 16 beds. The idea was to deinstitutionalize mental health care and have people served in their communities in smaller community-based mental health settings, which was a good idea, except there was no money put into community-based mental health, or not enough. So people were deinstitutionalized, they left these big facilities, went back to communities and didn't have the supports they needed. So roundabout way, that's what ended up happening was now we find that we still have a need for beds in larger institutions, and Medicaid won't pay for it. That's where a lot of our expenses are with respect to emergency detentions as the payer of last resort for those. So if Medicaid coverage through this waiver is approved, it's a state applying to CMS. If that's approved, it would allow us to recover some Medicaid reimbursement for those people that have Medicaid and go to one of these IMD facilities. That's not dead yet. That is, the effort isn't. I haven't heard any updates, but as far as I know, that's still a possibility. So we're hoping that'll come through to fruition. And the last thing was that peer support services are not currently funded through Medicaid except in CCS. They're paid for. But it looks like Medicaid, a rate will be established for peer support services sometime in April, which would allow us potentially to expand our peer recovery services more broadly and receive a Medicaid rate for that. We don't know, again, what that rate will be. I know when I worked in Minnesota, we went through a behavioral health reform effort there and received about a $65 an hour reimbursement for peer services in Minnesota, and that was a few years ago. So I'm hoping it's something similar to that, though, something that would incentivize providers to want to incorporate peer services into what they do. It's a very cost-effective and effective way to kind of a missing link in the behavioral health system. So I hope that works. And the last thing was just to let you know that we're monitoring social service block grant funding. The federal government hasn't released block grant funds to the state yet, so we're holding our breath to see if the amounts change. We did get a statement from the state announcing our allocation for the next year, but again, they warned us in that statement as they released those numbers that it was dependent on federal funding, and we're not sure what that's going to be just yet. So keeping an eye on that. And I think that's really the gist of it. The last part is more local. It's our operations and initiatives. I was going to ask if Shar would talk a little bit about the behavioral health restructuring and a couple of other items on that list, and then I'll just touch on vital strategies.
Okay. Welcome, Supervisor Rowan. My name is Shar Lopez. I'm the Deputy Director and the Behavioral Health Administrator. So a few things that we have going on is we have been looking at restructuring behavioral health. That was one of the pieces that went through the last budget. And in that, we were looking at taking the position I have right now that has both the Deputy Director and the Behavioral Health Administrator. And we also have another program that's a community-based program. So taking those two programs and putting them together because it's all behavioral health. And so we've been working, actually the 6 supervisors, myself, Becky Kerr, and Bob have been working probably for the last month and a half on what that looks like. And for the consumer, it won't look any different. The services will all be the same. And really, it will be who supervises the supervisors. And so I think we're going to have a very smooth transition, and I don't think that there will be any glitches. There may be a few, any glitches, but for the most part, the consumers won't notice any difference. We applied for a grant. It is a community violence intervention prevention initiative. And it was a joint effort with our law enforcement. So I worked very closely with the sheriff's office. There was it was a really quick turnaround for this grant. We reached out to Waukesha County. They have a crisis intervention that includes having I think they only have actually 2 crisis workers within their 911 center. So there's an immediate transfer to those crisis workers. So the time from the call to the intervention is almost instantaneous. So we're really hoping on that one. It's a 4-year grant. We also looked to get some pieces to enhance safety for law enforcement. So there's a new proposed Bearcat, I think it is. It's like a military type vehicle that assists in safety for officers in dangerous situations. Barriers for like parades and things like that. They don't have their own. Sheriff's office doesn't have their own. They borrow them right now. And a new scanner for the jail. So all of those things, if we get this grant, would definitely assist our KIP funds. And the total that we asked for was $1.7 million, and that was over 4 years. The last thing that I will share is we were notified that our Adult Protective Services team was nominated for our innovation that we have within our I-teams. I-team is a interdisciplinary meeting quarterly. It's required for Adult Protective Services, and our state representative comes to ours all the time, and he indicated that it's the energy that our community members engage, and the community members that we have are folks from the ADRC, long-term support, or long-term care facilities, the managed care organizations, law enforcement, attorneys, banking institutions, guardians, behavioral health staff, hospitals, and then just community members as well. And if you've ever been to one, there's always a learning component. And then they have an opportunity for like case discussion. The next one is December 17th at 1 upstairs so if anyone's interested, it's on the financial exploitation. And you're welcome to join, and you can actually feel the energy. It is like it's probably 60 people in the room every single time they have a meeting, which is pretty remarkable. So, and I'll let you cover the other ones.
Thank you, Shar. And just quickly, that we did receive a Vital Strategies matching grant for opioid settlement dollars that we've already received. Vital Strategies is a global public health organization that offered this matching money to counties or nonprofits or whoever received settlement dollars. So we applied and got $100,000 from Vital Strategies for 1 year matching dollars, and we're going to use that to expand upon the position that we already have in place, a substance use professional that's working with Children's Services to work with families and Child Protective Services who are affected by substance use. Did I say that right? So, so this position that we're funding with these dollars already works with families affected by substance use in our Child Protective Services, and we're going to expand that role with this grant funding to include that position being involved in family treatment court, and we're going to include a portion of that money. We're going to direct it towards our public health division doing an evaluation of those efforts to see how effective they are. We have about, of those families in CPS affected by substance use, it's about 70%, it fluctuates, but about 70% of those families have some substance use related issue that has led to their CPS involvement. So we know that's an area where we could make a difference, and we're going to try and evaluate that so we can show you if it made a difference or not. But that's what that money's being used towards. We only got half of it right now. That's how it's supposed to work. And then we'll get the other half after we show in our quarterly reports. I just did one. Our quarterly reports will reflect the progress we're making, and then they'll give us the second half of that money. I don't think there's anything, if you have any questions.
Shar, do you expect the grant to be approved, or?
So the due date was when the government was shut down. It's a federal grant. So I'm hoping that we hear something very soon. The deadline was the 3rd of November, so.
Oh, the turnaround may happen quickly.
I'm hoping so, yeah.
Okay. And could you include me on an invite to the I-team so I remember? Absolutely. Thank you. Any other questions?
Oh, great stuff.
Thank you for the report. It was very good. Update on food share and SNAP benefits.
Hello, everybody. I am Rhonda Brown, the Economic Support Administrator, and Bob asked me to do an update on food share this evening. I recently talked with you guys about that. On November 13th, DHS notified the consortia that the government shutdown had ended. That was in the media, of course, as well, but we waited for official notice. And the November benefits that were confirmed after November 1st were issued overnight, so we're caught up at this point. And then at a later time, they notified us that the new legislation that was passed by Congress actually had ensured funding to USDA for food share or SNAP benefits through September, so through the current federal fiscal year, which was good news for us, somewhat unexpected. So that was a detail that we have. Consortia, call center staff, we were business as usual throughout the federal shutdown. And obviously that continues now. So we were answering questions, processing changes, renewals, new applications. And we obviously continue to encourage constituents to reach out if they have questions, to contact our call center as they have in the past as well. The Food Share News for Member page that DHS has committed to providing updates on is still viable at this point. It was out on the our SharePoint site, our county SharePoint site, and I think some social media sites as well. After talking with Adam earlier today, I believe it is still on the county's webpage, obviously with having removed the reference to the government shutdown. But it's still a place that the public can check for any updates about the SNAP program. Last time we talked about when the One Big Beautiful Bill Act was signed into law, there were other administrative and policy changes that relate to food share. We talked a little bit about the expansion of work requirements for the food share program, and we are in the beginning stages of implementing that. It requires a lot of system changes for that to occur. So it's being phased in, and it will occur for most when they come due for a renewal for individuals who are receiving food share. Our system has been kind of limping along, to be quite honest. It's been challenging for us just with all of these changes. So I'm glad actually to hear that it's not going to be an all at once thing. I think that will be best for staff and obviously best for consumers as well. And when members are going to be impacted by that, any member that will be impacted by that change will receive written correspondence by law. So they should be checking their mail, their access accounts, texts, etc., as I said last time. The other thing I wanted to mention in relationship to food share is that consortia statewide at Great Rivers have been meeting now monthly with DHS in terms of get our quality control efforts to reduce our payment error rates in relationship to SNAP. Our collective error rate needs to be under 6% to contribute the least percentage to benefits. I talked about that last time, so I won't go into great detail. And we just received data through June of the federal fiscal year, so we have July, August, and September to go in the total. Statewide, our active error rate is currently 6.17%, so just above. And for Great Rivers, it's 6.61%. So we are working very hard to do quality control reviews, to analyze them, assess data, talk with staff, share information locally, training, coaching, all the things. So I just wanted to mention that. We're close. It requires, obviously, though, a statewide effort, and there are definitely other consortia who are in a higher range. So, you know, we're doing what we can for that overall number. And then the last thing I would just mention is that Medicaid will have work requirements, as you're also aware. That will be more 2026, late 2026, 2027 that we'll be looking at that, but just mentioning that as well. Just to reiterate that the food share benefits obviously took center stage for obvious reasons, but there are other things that we're incorporating and dealing with as well. Any questions on any of that?
Anybody have questions? Good, Kathy.
So I think you mentioned this last time was about what the errors kind of were. And can you maybe describe like what some of the common ones are? I think that when you hear error, everybody thinks it's, something really egregious, but I think some of them could be very tiny too, right?
Yes, anything counts toward the error, and there are worker errors that occur. There are client errors that occur that can just be missteps or perhaps misunderstanding things. Again, I mentioned last time, this is not a fraud type situation. These are true errors that are occurring. So maybe somebody neglected to report something or didn't know that they needed to do that. As far as client error, since the beginning of time, employment and earnings are our top error area. And so we try so hard to get at that. I think it comes down to the complexity of the programs and the information that we're processing and things like that. Turnover comes into play as well, so. But yeah, there are also some errors that are included that have to do with correspondence, which is not anything we have control over either, right? So the state determines what that looks like, and if FNS says that this particular correspondence for, let's say, a new application that goes out doesn't have this language, it's called an error. So there's some within our control and some outside of our control. Yes, thanks for the question.
Any other questions?
I was just going to add to Rhonda, the shift in federal funding. Did you mention that and I missed it? The shift from the reduction of federal funding to higher
The
state.
administrative funding,
Yeah, and
the match change.
yeah, and that will have certainly an impact. But we did, the county board, well, the HHS board and the county board passed a resolution in support of the state finding additional funding to support counties. So we're not as impacted by that as we might otherwise be.
Yes, absolutely. And thank you for that support, appreciated. Yeah, I didn't mention that because that feels more outside of our control in terms of what we're trying to do, but yeah, absolutely a factor as well. So a lot of different things. Any other questions?
Thank you.
Yeah.
Presentation about the American Public Human Services Association IT Solutions Management Conference.
She's up again.
I am up again. And Kathy, I may touch on your question actually in relationship to things like errors and maybe some things, ways that technology could be deployed to help with that. So to shift gears, the Wisconsin County Human Services Association sponsored Sean Tessman from Dane County and Capital Consortium and myself, so 2 individuals from our Economic Support Policy Advisory Committee, to attend this conference in Reno, Nevada. And, you know, as the name implied, there were individuals there that were more in the know on administration and policies and things like that. And obviously the technology experts and vendors, et cetera. So, you know, there were some really major vendors there. Deloitte, which is a major vendor for the state of Wisconsin. You know, they manage our care system. They manage a lot of our analytics and reports and things like that we utilize for some of the things that I just spoke about. IBM, Microsoft, DocuSign, Equifax, Gainwell Technologies, another vendor for the state of Wisconsin who just recently automated some processes for premium payments. So part of the work that we were doing for initial payments actually went to Gainwell now. So it's more automated for the consumer and it's less work and confusion for us. So that's just one example, right, of working with these various vendors. The central concepts were in September were HR 1, or the One Big Beautiful Bill Act. And then in relationship to that, of course, advancement and modernization. I had said while I was there that for me it was a bit of a dream come true and got teased for that. But it truly was to be in a group of people that are passionate about health and human services as I am, and also technology as I am. So to be able to be in a group of people that really were there to talk about and utilize the same language that we speak in terms of health and human services and our income maintenance programs and things like that, error rates and all the things was exciting to be part of it. So I'm really grateful for the opportunity to have gone. Shared ground was a desire really for, you know, innovative solutions. So how do we help manage our budgets? How do we quickly implement changes from HR 1? So I just talked about some of those, right? And the systems that we currently have, some of our legacy systems take a lot of time to update as they stand now. How do we maintain programs and services? How do we provide enhanced support to our staff? So again, coming back to error rates, what are things that we could do in our system that would help us reduce error rates? It's kind of a no-brainer that that would be a priority both for the state of Wisconsin and for our consortia as well. And how do we deliver a fluid and personalized customer experience? That was another message in many of the presentations. Sean and I, who is currently in Fiji, so I'm a little jealous, but we decided to divide and conquer. So she's not a technology person, so she went to more of the administrative policy area, and I focused on technology. So we sort of came together at the end and did 2 separate presentations in that regard. So I touched a little bit on some of the information that she gathered as well here. But the message was the same, right? You know, there's challenges, which I'll cover in future slides here. To quote Reggie Bika, who is the president and CEO of APHSA, and quickly, Reggie hired me in Pierce County, and I had no idea he was the president. So I saw him at breakfast and had like a fan moment to go talk to him and catch up. But anyway, the human services agencies across the county are well aware of the opportunities and challenges that AI brings to the field. He talked about in the next 12 to 18 months, there's going to be work at the national, state, and local levels, how to best incorporate it, right? We've already had some of those conversations. And a huge learning curve for us is to understand all the opportunities and making certain that we are leading the efforts around AI. And really, rather than the technology leading us, right? And that has been my message to our ESPAC group for probably going on a decade, and probably annoyingly so, which is probably one of the reasons why I was selected to go to this conference. But really, and within our consortium as well. So technology is here, it's advancing. AI is here, it's advancing. So rather, we just need to replace fear with curiosity. What can we learn? You know, what kind of challenges can we solve? How can we use it to our advantage? And how can we know enough to participate in these discussions? So I created a lot of materials for ESPAC with just some common language, so that when DHS asks us for feedback and input, we are prepared to be able to at least talk in a general sense. Next slide, Killian, thank you. At a high level, our sessions really conveyed that AI opportunities can influence, impact really any area or framework that you can imagine, as you see there. So at an agency level, with administration and workforce, operations, regulations, policies, procedures, employees, of course, with resources, tools, job duties, hiring, how do we engage them? Similar with consumer experience, how do we interact with them? How do we share information? How do we describe our programs? What services and tools are available to them? And logistically, how can they access those most efficiently? And then technology, of course, itself, the infrastructure, the framework, the hardware, the software, information and security are obviously critical. And then the data itself, so systems and banks, archives, sources, the analytics stuff. I mean, we as I've said in the past, our role is highly technical already. Everything we do is in a system. Everything we do is electronic, including our files. We have a lot of data. And just speaking from an HHS perspective, right, there's a lot of opportunity. They're great. Economic support, I think, has a lot of this already, but there's certainly a lot of area for expansion, especially with AI and more advanced technologies. And thinking about it from a use case perspective, really, so the why, what is the desired business outcome? What's the problem and solution? What's the benefit and the evidence? What's the risk and reward? Those are the conversations that we should be having. And I think the fear around technology is talking about it from a technology perspective. But we all have knowledge when you shift the perspective to those things. Again, what are the business outcomes that we want? So oftentimes when I have talked about AI, most common is someone saying, oh, I have ChatGPT. I use ChatGPT. That's what they think AI is. And that's true. But in order to think about this and to be able to utilize it and incorporate it, I think we need to shift away from the tool and start with what problem, what business outcome. That's where we need to start thinking about it. And when you do that, it pulls the rest of us into the conversation and not just the IT folks. So I think that's important. And again, this conference had people who could speak both, which was great. Familiar things that we heard, these I'm sure will sound familiar to you as well. So HHS is under pressure to deliver services efficiently, effectively. Whether we want or intend to improve technology and services, budgets are already strained and they're not likely to get better. The tone of AI from the federal partners has shifted dramatically. That was a message that we had heard. They really don't want to be too prescriptive. They do believe that AI is part of the answer to implementing some of the HR1 initiatives and really other initiatives across HHS as well. Agencies should consider taking a position on AI in the delivery of services. So that's something they talked about. The quote here from my colleague who I emailed to ask who said it, and she's in Fiji. In the cloud of what is possible, leaders need to define what is off limits so that AI can enhance human services capacity in a manner that is consistent with human needs and not vendor capabilities, which I think is a really powerful statement. Some of the examples that she had in her slides were, would you be okay with AI drafting a service plan or doing an eligibility determination for us, for Medicaid, or making a placement decision? Those are areas where some are pretty quick to draw a line. Others may not be, but those are some of the conversations that we had. Agencies vary in their data modernization readiness. All agencies should assess where are they behind, where are they ahead, and what is the risk of doing nothing? You know, is the cost of being behind or doing nothing greater than the cost of a new system, for example? And in many of the discussions that we had, if somebody were to can your legacy system handle AI? But if you build a new system, by the time you finish it, is it going to be outdated by the time it gets done? So those kind of conversations. Again, identifying innovation officers. So thinking about this from the perspective that I talked about in the last slide. Not thinking of it as an IT project. The majority of us are not going to build AI or advanced technologies. We need to know how to use it and apply it. And then including a cross-section of employees was another message. And lastly, to formulate 4 to 8 solutions to diligently pursue was the recommendation. The next one, the notion that good enough for government is outdated. So a higher standard is expected by consumers and really employees. We're hiring people who only know technology. We need to know technology. We need to have resource and tools that offer technology. For customers, providing as many options for them as possible. So digital options, physical options, desktop options, mobile options, and then removing the silos and promoting interoperability as much as possible. The message, of course, being that constituents require multiple services. You know, their journeys are often unpredictable, disorderly, nonlinear. How are we going to do that? And in a lot of situations, they are repeating the same information to multiple divisions, even within HHS. But certainly if you think about the justice system, other food resources, housing. And then the last one, the job of a caseworker is harder than you think. It lacks balance, and turnover and burnout are real and costly. Those are facts. So when you think about it from a technology perspective, we can't clone a worker. And is having more staff really the answer? Or do we look at cloning or automating a repetitive task that they're doing that supports them and supports consumers? And in some instances, we can do both with the same technology. I think the message is that we're all dealing with uncertainty and volatility. You know, we're all trying to plan ahead. We're all trying to make decisions based on information that may be not even true in a month or a week. You just watched us go through that with food share. And I think that's more so the case. So we really have no choice but to embrace it and to think about it from, you know, a skills and capability standpoint, right? Kind of to prepare for whatever is coming so that we can scale services and we can shift resources because we're focused less on just a particular job and more on just, expanding the skills and capabilities. That's the message. And with my staff, I do that all the time already. You know, especially our team leaders. Like I always say to them, with technology, as far as that goes, don't rely on other people to always troubleshoot. Understand stuff, learn stuff, know how to get yourself out of stuff. And they're very good at doing that. You know, I promote qualities, just continuous learning. Be curious, I say that often. Imagination, judgment, critical thinking. That's that skills and capabilities part, right? That should be across all positions. Again, not just talking about particular jobs. Any comments or questions so far?
I had one just
Yeah.
quick. Is each state's administration like software different?
Yes.
Oh, God.
There are 24 states who utilize the same vendor
Oh,
for
what a
food share
mess.
benefits, for example. But yeah, that was also a unique part, and they were, a lot of them were there. So it was interesting to talk with vendors that serve other states. And we're siloed to a degree. The systems that we use, the care system that we use has child care programs, income maintenance programs. We also have W-2, so we have some of that already, but it could certainly be expanded potentially. So what did I see on the technology front for income maintenance? We observe present and future technologies that can be deployed side by side with human services, human caseworkers, human customers. Topics and solutions were centered around efficiency, support, coaching, training, quality, performance. These sound familiar. I feel like I say these words all day, every day. Timeliness, accuracy, those are our contractual requirements, and adapting to new policies and procedures. And again, that is a discussion that we are having all the time. Our stuff is always changing. I think I've said here before, we are changing the tires on a moving vehicle every day. And it is only happening more quickly, if anything. So, but it's nothing new for us. I was able to talk with vendors one-on-one, obviously listening to presentations, and really the most exciting part was I got to sit in Deloitte's demo room, so sit in a chair in front of things that they are working on, asking questions, and they really wanted suggestions from the local agency and local worker perspective, which was amazing to be able to do that. So they are thinking about things all the time, and they are interested in hearing what isn't working great for us, or what ideas do you have about how to support your staff better, to support consumers better. So that was exciting. AI can help IM stakeholders in terms of connecting constituents to programs and services at their convenience through personalized channels and transforming their overall experience, so improving outcomes. And one of the things that they talked about more is we're doing a lot of this already. We have an online application process that is already combining other programs outside of income maintenance. But it's shifting it to be more proactive. So notifying people sooner before something bad happens, or analyzing what do they use? Are they most responsive to text, to emails? What are they paying attention to? And doing that more on a personalized level so that if we do want to reach them, we know the best way to do that. We could start analyzing more of those things. Improving the caseworker experience by combining work and learning, as well as by automating routine tasks, for better prioritization of critical and meaningful tasks. So one of the things that I had mentioned already is turnover, burnout. It is a high burnout job. A live call center is intense. There's no doubt about that. And one of the challenges for us is that it takes a year to train one of our staff to really be proficient. And so one of the things while I was sitting in that Deloitte demo room was how can you surround staff with the information that they need to know? How can you synthesize 5 handbooks, process help, all the things that we're looking at, just to try to understand how to apply a policy and how to process something in our system. It is insane the amount of information that we look at all the time. There has to be a better way. And rather than sending someone to training for a certain period of time, if we can immerse them in what they need to know on a daily basis, that sounds like efficiency to me. Just one example. Improving system efficiency and effectiveness that better supports consistent practices, efficiency, timeliness, accuracy. Again, those are words that we use every day. There are contractual requirements right there. We are a division who follows strict policies and procedures, federal poverty guidelines. We don't have a lot of independent decision making. We do a lot of critical thinking. We do a lot of synthesizing information. We do a lot of making sure that things are timely and accurate, but it's based on other policies and procedures that we're following. Reducing administrative burdens by providing tools that more easily adapt to frequent administrative, regulatory policies, process changes. Our current system is slow to adapt. We have, they're referred to as CARES releases a couple times a year, where they'll roll in any of the changes that need to happen. And if there's any financial or time space for us to offer some additional things that could be helpful to us, they'll ask us, and we provide them feedback. We actually vote. We have a long list of them, and we vote on top 3 and we submit them. So that's kind of our current process, right, for getting improvements in. They recently did that for Genesis Cloud Services, which is our call center software. And I provided 9 ideas, all AI, all advanced technology. And they all made voting with the exception of 1, which was interpreter services. For some reason, that's not possible in our software. But just again, to give you kind of an idea of how we're already having these conversations. And then supporting predictive, proactive, data-driven decision-making that provides real-time actionable insights. So one of the demos, again, just to give you another real-life example, but can our call center software tell us more about what are people calling about right at this moment? Are the people that we have online the best people to answer those questions? Or should we create a greeting in our call center, informational greeting with information about that particular topic? Or can it say, it can assess the fact that maybe someone is struggling on a call and it can ping a supervisor? Or in some circumstances, which do happen on occasion, Maybe it calls law enforcement. So these are, again, just some real-life examples. And these are some additional examples that we're already talking about with DHS, but intelligent document processing. So currently, our staff process a lot of documents. They are electronically attached to a case. They're processed and put in an electronic file. So we're ahead in some respects. Probably not anymore. We were there before a lot of others were there. Let me say that. But now what they could do with those is to input them into our system. So not just scanning them for us to process, but scan it right into the page. So that our staff become, and I think I mentioned this before, but the upskilling, reskilling, right? That's that skill and capability thing. You still need the staff person, but rather than entry, they're gonna review their information for accuracy, a word that we've been talking about a lot. So that's just one example. In addition to that, it could be used to detect a fraudulent signature. It could detect anomalies, for example, on maybe something someone reported 2 days ago. They submit something now, right? Not saying that's intentional, but again, that may be client error type situation or something changed. You know, again, things change quickly for some. Conversational AI, more of an AI bot in some respects, but it could help callers maybe articulate to us what they need rather than pushing a button for a prompt, because a lot of our calls they end up going to the wrong queue, for example. Someone self-selects wrong. I'm sure I've done it myself. It can help guide them to the correct queue automatically based on what programs they're open, for example, or based on their voice versus pressing a number. I just had to troubleshoot a user error that was very similar. They actually thought our call center was closed and it was just a user error on the button they pushed. It could check for eligibility, answer coverage questions, you know, maybe some claims and billing questions, which is not us, it's member services. But there are a lot of things they could be doing conversationally, probably with AI and various speech analytics. Another thing that they talked about was a customer chatbot, so, you know, using it for frequently asked questions, helping to guide consumers, making recommendations, handling some routine tasks, escalating complex situations to a human agent, similar to Amazon or other places that you've likely had experience with. Maybe it's most appropriate for our Access online access webpage. Maybe it's more appropriate for my Access mobile that already exists. So again, we're headed there. The proactive outreach, so again, kind of similar to what I said before, but maybe more automated messaging, more personalized automated messaging, time-sensitive alerts. You know, maybe the alerts include a link to information and not just telling them, hey, you need to do something, but actually send them the form, for example. And again, trying to do that before something happens, before something's undone that we have to redo, right? And then an intuitive self-service portal. So again, more intuitive, we'll lean into that word. So, and then maybe more that we could do more dynamic workflows, dynamic text messaging, things like that. I'll just mention some other higher level concepts were low code, no code. That was a term that came up often, which is really Microsoft Power Apps already does that. Google Workspace, Google Cloud, Genesis Cloud Services that we use for our call center is considered that. So really it's just the ability to be able to make changes to a system more quickly. So think about a SharePoint site, for example. You can go in and make changes to that without having to completely recode your system or a component of that system. Modularity for having separate business rules for core programming, So again, that we can initiate some of these changes more quickly into our system. And then interoperability. So that was a big topic, and really that's probably the panacea, if you will, of what we could do. But it's having more and more things together so that they don't have to repeat processes for services that they're currently receiving. Unified profile was also another high-level concept that was talked about, and there were certainly vendors there that are doing that. So being able to share their information with individuals, again, more efficiently across human services, across other agencies. Sorry. Any comments, questions?
Excuse me. Sounds like you need to be more flexible, yet you have to be rigid to follow all the rules.
Yeah.
How's that work?
Yeah,
That's just, you don't have to answer that.
it's true. Yeah.
Go-
Girl, you are perfect for this job.
Thank you.
There's nothing better than an administrative person that is positive and initiating change the way that, I mean, you're excited about it, and that's huge. It always was in my career. When you had somebody come to you and they were negative Nelly trying to tell you what you had to do, you're awesome. Thank you.
Thank you. I appreciate that.
Anybody else have any comments, questions? Thank you very, very, very much.
Thank you. I appreciate the opportunity to come and talk to you always, so thanks for your time this evening.
Excuse me, that ends the business part. Any requests for future agenda items? Hearing none. Announcements. Oh, Bob, really?
Just one, I do want to also echo what Supervisor Lynn said, though, about Rhonda. We have some very thought-provoking conversations around the evolution of our department, around technology and other things. But I think it was a real honor that she was selected by the Wisconsin County Human Service Association to represent Wisconsin at this Nevada conference. You can understand why she was selected, but really nice job. Yeah. Yeah. And the only other announcement I had is also positive, so that's good, huh? The New Richmond Area Chamber of Commerce selected our healthcare campus as the nonprofit of the year for their award. So, yeah, that's great. And there'll be an award ceremony, a gala, on January 28th at the New Richmond Area Chamber of Commerce. So that was the announcement I had.
I'll give one announcement. I'm the site leader for Ruby's Pantry for New Richmond, which is going to be starting up again tomorrow at the National Guard Armory. And we've got a lot of volunteers signed up to help, but it's been a juggling act to get this off the ground again. It hasn't been a Ruby's Pantry in Richmond, I think, since January. So, but very excited about that. And so it's another source for food, and hopefully we can help a lot of people.
Good job.
Our next meeting is scheduled for December 17th. If there's nothing else, we are adjourned. Thank you.